ただいまより閉会セッションに移ります。
We'd like to start the closing remarks session. The speakers will come up on the stage, so please welcome them with a big round of applause.
最初に
First is Mr. Kazuyuki Nakane, Parliamentary Vice Minister for Foreign Affairs, for closing remarks. Floor is yours, sir. Ladies and gentlemen, good evening. It is indeed a great pleasure to be able to participate and present my greeting on a fantastic opportunity called Book Launch Symposium on Japan World Bank Partnership Program. The theme today was a book launched symposium on UHC for Inclusive and Sustainable Development. So this is the symposium, a book launch commemorative symposium. For 3 years, people have participated in this joint research. Researchers, authors, people from the World Bank, and Mr. Keizo Takemi, who had been positively asking questions until a moment ago, as well as all other people who worked so hard in realizing this joint research. I'd like to offer my heartfelt congratulations and appreciation. This report, in the report and in today's presentation, the important elements were presented like healthcare finance and nurturing healthcare professionals of UHC. The 11 countries were analyzed with various different stages of attaining UHC. Common challenges and shareable experiences became identified. One of the themes of today is lessons from Japan. Japan maintained the universal insurance system for more than half a century, attaining the world's #1 healthy longevity society. During the rehabilitation from the devastation of the war, we were poor and the medical level was low. But the introduction of the health system was the basis for attaining a healthy workforce. So it was the UHC brought about today's prosperity, not economic development, bring about UHC. As a country promoting UHC, we hope that the insights obtained in this research would be utilized fully in the future discussions, and there will be active accumulation of knowledge. As far as our ministry is concerned, we would like to work toward the necessary contribution on a continuous basis. UHC knows no boundary between developed and developing countries. It's a key to all countries. In the recent time, the Ebola hemorrhagic fever is rampant in West Africa. In the affected countries, primary health care was very vulnerable. That aggravated the situation, according to some opinion. So in order to prevent the public health-related crisis like Ebola, we know that there has to be a resilient health system constructed where primary health care is respected. The key to that is UHC. In our country, the healthcare is positioned as an important challenge in our diplomacy. Last year in May, we formulated a healthcare diplomatic strategy, thereby as positively and proactively promoting the international cooperation looking toward UHC. Going forward, we will continue to tackle the measures against the communicable diseases as well as mother and child health, so that we can have an inclusive healthcare system strengthened. Together with France and Thailand, which are jointly promoting UHC in international arena, we will be co-sponsoring UHC awareness events so that there is a better understanding for UHC. Last year, with the presence of our Prime Minister and Foreign Minister, we organized an event called Healthcare and Development. In this year's United Nations General Assembly, we co-hosted the side event regarding 4 side events on UHC. One of them was presented by Foreign Minister, and we showed our country's commitment. So there is a progress toward the diffusion and propagation of knowledge about UHC through such events. So such efforts are becoming effective effective in the open working group report regarding the Sustainable Development Goal, which was formulated this summer. Healthcare sector is regarded as one of the targets. UHC is suggested. Going forward, the post-2015 development agenda successor to MDGs could have UHC as one of the agenda items. So we'd like to work toward that. And together with the supporters of UHC, the ladies and gentlemen who are gathered here today, we would like to act in unison so that we are greatly helped by your endeavor. Lastly, but not in the least, once again, I congratulate the successful holding of this symposium. With that congratulation, I'd like to conclude my greeting. Congratulations to all of you. Thank you very much for your attention.
Thank you very much, Mr. Nakane. Next, on behalf of the sponsor of this event, we'd like to invite Special Representative to Japan of the World Bank Group, Mr. Yasusuke Tsukabashi. Ladies and gentlemen, we'd like to thank you very much for taking time out of your busy schedules to attend this symposium. You listened with great enthusiasm until the very end. We're indeed grateful. The UHC penetration and Japan's medical and health systems. We had a very outstanding discussion on this topic, and it was a very fruitful symposium. On behalf of the World Bank Group, I'd like to extend my heartfelt gratitude. And today was an event to celebrate the publication of the report, which is a result of joint research regarding UHC between Japan and the World Bank. I'd like to take this opportunity to express my due respects to Mr. Keizo Takemi and the co-authors, as well as Ministry of Finance and JCIE, and all those who have made the effort. I'd like to express my due respect to the efforts they have made and my appreciation. The World Bank Group has the objective of eradicating extreme poverty by 2020. And to promote sharing of prosperity throughout the world. That is our major objective. In achieving these goals, the achievement of UHC is of foremost importance. As is the case of Japan, the World Bank Group has committed to provide support and to promote various countries coming to grips with the issue of UHC, so that the poorest women and children can have access to medical service, high-quality medical service when necessary and at an affordable price. UHC has the objective of eradicating those who face poverty because of co-payment. Every year, 100 million people face poverty because of co-payment. In order to eradicate poverty, we need to take up the issue of co-payment for the poorest class. But that alone would not solve the problem. Education, social security, power, road, infrastructure, transportation system, water and hygiene, public finance, information technology, development in all of these areas is very important to bring health to all people. The World Bank Group, along with international institutions and various countries, inclusive of Japan, must also incorporate the private sector to comprehensively deal with these issues. UHC is an issue various countries are taking on, and we can learn from different experiences. Japan has achieved UHC over 50 years ago. And we have materialized sharing of high economic growth and prosperity. We are a treasure chest of knowledge and lessons. So Japan and the World Bank conducted this joint program so that the countries of the world can tread a more appropriate path toward the achievement of UHC. And it is expected that we will play a greater role, taking into consideration the advancements in different sectors to formulate effective and efficient strategies. Our mission is to enable the achievement of UHC UHC by all of the countries, including low-income countries, regardless of geographical conditions or size of country or the cultural factors, and to receive the benefits. It's not an easy thing to do, but it's doable, and we believe that it's an eminent issue to eradicate poverty. If we look at the Ebola hemorrhagic fever and the battle concerning this disease, we see that there are still many issues that we have to come to grips with. Those countries that are suffering from Ebola lack the systems, the medical systems and the health systems, and that is the source of crisis. And it is a concern that this will lead to major economic and social damage. We have to look beyond overcoming the crisis to strengthen the health and medical system, and we have to take a comprehensive approach. The World Bank Group, in cooperation with the Japanese government, intends to make efforts to support UHC and also to strengthen the medical and health system in the developing countries. Lastly, we hope that this program will contribute to the achievement of UHC and also the human security, which is a policy of Japanese diplomacy. And with this wish, I'd like to conclude my greetings. Thank you very much. Thank you very much, Mr. Nakane and Mr. Tsukagoshi. They will be leaving us. Could you send them off with a big round of applause? Thank you.